We are very much honored to launch the implementation of the SLL in Rwanda by Africa CDC in partnership with MasterCard Foundation. We are also very much pleased to acknowledge the presence of our able implementing partners, AMREF for support of COVID vaccine centers, IDI Makerere for implementation science, conduct of research on real-world vaccine effectiveness and public health impact. Actually, Rwanda is the best country where this can be done, and lessons learned in achieving the immunization target and the achievements and the gaps can be analyzed, and actually this could be shared to other parts of the continent. And Rwandan Red Cross for risk communication and community engagement, and the UNICEF for procurement and logistics. It's an opportunity for us to have wealth of experiences from our implementing partners in these areas. The Saving Lives and Livelihoods initiative and implementation we are launching today will synergize the efforts of the Rwandan government, Africa CDC, and all partners in increasing COVID-19 vaccine uptake in the country. Actually, the advantage of SLL is not only to procure and provide the vaccines, it's about building capacities in areas of the CVZ, RCCE, and other efforts. Thus, it would also support building the national capacity of immunization. Ladies and gentlemen, allow me to say a few things about complementary efforts by Africa CDC in general. In the aftermath of the 2014-2016 Ebola outbreak in West Africa, where more than 28,000 people were infected and 11,325 have lost their lives, our heads of states and governments, taking into account the health challenge of the continent and the need for a continental health framework, approved the establishment of Africa Center for Disease Control, Africa CDC, and it was established in January 2017 as a specialized health institution of the African Union, with the objectives of supporting African Union member states in their efforts to effectively detect, prevent, and respond to public health concerns based on science, data, and policy. Dear colleagues, while Africa CDC was merely 3 years old, it was challenged by the current COVID-19 pandemic to coordinate and respond. As Africa CDC, we greatly appreciate the swift action through our leaderships and heads of states in mounting a continental response. We thank you, Rwanda, again. Paul Kagame was one of the African leaders who was championing during this COVID-19 response. As our commitment to controlling the ongoing pandemic, African Union Commission through Africa CDC has supported in this region the member states in different aspects, including deployment of over 4,000 community health workers and 64 experts on different areas of response as rapid responders, strengthened surveillance systems for early detection and contact tracing, supported in clinical case management, an expansion of COVID-19 testing capacity and genomic sequencing through training of laboratory experts and provision of laboratory supplies, and the establishment of regional integration of surveillance and laboratory networks, and also coordination of a platform where important health exchange, health information is exchanged or shared in the region. Dear colleagues, however, COVID-19 vaccines remain a critical tool in reducing transmission and ultimately returning the economies of Africa to normal. Recognizing that the only way to end the pandemic and safeguard lives and livelihoods on the continent is to rapidly immunize the critical mass of Africans, the African Union heads of states and governments endorsed the COVID-19 vaccine deployment and access strategy on 20th August 2020. This strategy aims to vaccinate at least 70% of the African population with safe and effective COVID-19 vaccine to move closer to the population level immunity needed to bring the pandemic under control. Our governments, in concert with national, continental, and international partners, have tirelessly worked to enhance vaccines availability in the continent through various mechanisms, including the COVAX, the AVAT, and we are now launching the implementation of the Saving Lives and Livelihood Program, the SLL. As I said earlier, the SLL is cross-cutting, building up the capacity of distribution of even the other vaccines the country is having, and also supporting the national immunization program. Ladies and gentlemen, the SLL initiative in total is a 3-year US $1.5 billion partnership between Africa CDC and MasterCard Foundation, designed to save the lives and livelihoods of millions of people in Africa and hasten the economic recovery of the continent in the wake of the COVID-19 pandemic. The SLL initiative is acquiring vaccines for more than 65 million people, supporting the delivery of vaccinations to millions across the continent, laying the groundwork of vaccine manufacturing in Africa by focusing on human capital development and strengthening the capacity of Africa CDC itself. Dear colleagues, our continent, Africa, has vaccinated fewer people relative to other regions, receiving fewer doses at a slower pace with fewer resources available for delivery. Overall, delivery infrastructure is limited, including warehousing, cold chain equipment distribution, capacity, staff, and required IT systems. Moreover, Africa is likely to face unique challenges with hard-to-reach populations, including informal economies that have many workers with high exposure risk, rural communities, nomadic pastoralists, and hard-to-identify population in humanitarian context. As part of the major efforts to break through the above challenge and undertake the gaps in vaccine delivery, through the Africa CDC SLL program, a thorough engagement was done with African member states during the preparation phase. Detailed technical assessment and analysis and consultative country engagements were conducted to prioritize areas of support, and comprehensive country support plan was prepared. Actually, we have also to apologize, as it also the process took some time. Even the country engagements we did and the prioritization we made also changed through time. And we had to revise that again. So still, it has to be customized to where we are in the country context and situation. For Rwanda, the CSP was prepared with a strong focus on risk communication and community engagement, procurement and logistics, implementation science, and strengthening of the CVZ through workforce development and strengthening peripheral CVCs. This will enable Rwandan citizens, particularly young people and rural populations, to access vaccines, to break transmission of chain, and mitigate the pandemic's impact. Based on Rwanda CSP, the micro-planning was prepared jointly by the Rwandan RBC, Africa CDC, and the implementing partners. This benchmarks an exemplary collaboration among the implementing partners. Ladies and gentlemen, Africa CDC is also supporting the Rwandan government effort of vaccine manufacturing. The government of Rwanda has laid a foundation for vaccine manufacturing, and this is well aligned with the new public health order of Africa CDC. Local capacity building of manufacturing vaccines, PPEs, diagnostics and therapeutics, local workforce development, health system strengthening, and enhanced partnership. Congratulations again, Rwanda, for these initiatives. Dear colleagues, the launching of the SLL in Rwanda signifies existing cooperation, coordination, and support on public health emergency preparedness response between the government of Rwanda and Africa CDC. I would like to take this opportunity to express my sincere appreciation to the government of Rwanda and the Ministry Health and the RBC for their continuous support in coordinating our activities and response. I would also want to thank our implementing partners for the continuous commitment and effective collaboration, and also the Robert Koch Institute and the Packard for their relentless support. Thank you so much. Asante sana, murakoze chane. Thank you.
We'd like to thank you, Dr. Achamlesh, for that wonderful speech. Next, we'd like to invite Hassan Sibomana, the Acting Divisional Manager, MCCH, for the Rwanda Biomedical Center, for keynote address.
Thank you, Kamal. Thank you, Asha. Good morning to all of you. Yeah, it is a pleasure for us as MCCH division within Rwanda Biomedical Center to host you all in this room for this great opportunity of launching the SLA project. Finally, we are launching it. So it has been a while since we discussed this project, starting last December, and today, actually, we are very glad that finally we are going to launch this project. And as you know, we have been waiting for a long time this project, because actually when we started planning, at that time the vaccination coverage was very low. So last December, our vaccination coverage was 40%. And remember that our goal was to achieve 70% by June last June. And we are very happy that today actually we have achieved that target, because first dose now we have achieved 70% vaccination coverage, 68% fully vaccinated, 2 doses, and 40% booster dose. And today, it is never too late, because actually we still need this project. Actually today, the 8th August, we are launching, or we are starting also to vaccinate, to provide second booster to 60 years and above. So this is very important, because actually with this project, we shall be able also to achieve more. But also we are planning to vaccinate children 5 to 11 years. So meaning that our target is no longer 70%, because we are almost there, but we are increasing it up to 86% by December this year. It is ambitious somehow, but it is possible with support from all of you, all partners here in the room. And also I have to say that with COVID vaccination, it is also a good opportunity to strengthen routine vaccination. because even in routine vaccination, we still have issues where we need to close gaps. We still have a number of children who are not vaccinated. So we cannot say that we are good in COVID vaccination, but without having a very good routine vaccination. This is also very important. So without taking much time, so I would like to give the floor to Dr. Albert, our head of division in charge of HIV disease prevention and control, so that he can help us to launch officially this initiative. Thank you.
Dear Dr. Acham and colleagues from Africa CDC, distinguished guests and partners, colleagues from the Ministry of Health and RBC, and implementing partners, good morning again. First of all, I would like to start by welcoming everyone in this very important event for us, where we are launching this SLL project. This Saving Lives and Livelihoods partnership that is going to be implemented for the next 3 years is going to support and strengthen the national program vis-a-vis COVID-19 vaccination. But also, it's going to help us strengthen further the national immunization program, building on the existing structures. It is important to reach the target we have set for ourselves, being the national target, continental targets, to at least of our population, even though here in Rwanda we are talking about 86% of our population vaccinated against this COVID-19, which is going to help us mitigate the impact of the latter in the low social and economic recovery. To optimize efforts towards COVID-19, we all agree Africa needs vaccine equity with governance that emphasize the strengthening of national, regional, and continental institutions. In Rwanda, we prioritized COVID-19 vaccination alongside other efforts related to the management of this pandemic in our country. We've put in place coordinating mechanism that is well defined with clear roles and responsibilities through the National COVID-19 Joint Task Force, and the country has adopted a multidisciplinary approach to cope with the pandemic. We thank several stakeholders and donors who are currently supporting our COVID-19 vaccination efforts that are guided by the National Deployment and Vaccination Plan to protect Rwandans and minimize societal and economic impacts by reducing COVID-19 mortality. During our campaign in vaccinating our population, priority populations have been included, starting with health frontline workers, elderly people aged 65 years and above, people with non-communicable diseases, people living with disabilities, refugees, inmates, and other frontline and high-risk workers. As of today, Our vaccination efforts have expanded to include booster dose administration. And as Hassan said, today we've even started administration of the second booster for elder people, but also people with NCDs. Allow me to highlight that building on existing structures have facilitated the implementation of our national vaccination campaign against COVID-19. This is going also to strengthen further our structures in place that we are using in our routine immunization. This is really aligned with the building resilient systems for health that are going to be really needed when the country or the continent face the same or more severe public health events. COVID-19 vaccine administration sites have been set in both public and private facilities. This is to show everyone that the multi-sectoral but also a contribution from everyone was really needed to make sure the achievements we are talking about today in terms of coverage are really achieved. We have been receiving vaccines through different mechanisms, through COVAX, AVAT, or bilateral agreements. And all of this to make sure we are really covering most of our people and reduce the COVID-19 mortality. However, we still have some gaps that have to be filled. To mention a few, we've been talking about community awareness and engagement. We talked about implementation, science to inform further actions. We talked about logistics as well as the supply chain. We believe this project SLL is going to help us fill some of those gaps and move further with the strong systems in place. As the Rwanda government, we commit to work jointly for a successful implementation of this partnership and looking forward to have more of this kind going forward. I thank you very much. I guess I'm requested also to declare this partnership launched. Thank you.
This is an exciting moment. We are now officially launched. Yeah? Are you all excited? Cool. Okay. So the next session we are going to have briefly is have group pictures. Then we come back for some short presentations. Yeah, we are preparing. We'll just show you where in the next few minutes.
Hello.
And the Mastercard Foundation to support COVID-19 vaccination and strengthening health systems across Africa. So there are 4 main pillars in this program, and the first pillar deals with purchase of vaccines, where currently the target was 60 to 70 million doses, and currently we've been able to purchase 65 million doses, and this is through the AVAT, the African Vaccine Acquisition Trust. And of those 65 million doses, 48 million doses have been shipped to different countries around Africa. And the Saving Lives and Livelihood program has funded the shipping and administrative costs to UNICEF, and it has facilitated a total of 2.3 million of J&J doses to Nigeria. So the first pillar deals with procurement of vaccines. Now the second pillar, where we are right now, is we support deployment of these procured COVID-19 doses. And what we do is we procure the vaccines and the ancillary products. So currently in Pillar 2, 15 partners have been signed to support the SLL program. And 49 member states out of the total 55 member states have been onboarded and have joined the program. And through this program, SLL has been able to launch urgent support program to accelerate vaccine deployment in 12 member states whose vaccines were at risk. And this helped save 3.2 million vaccines. And we were able to supply iPads, laptops, IPC material, and logistics countries requiring urgent support, these 12 member states. And more than 8,000 workers have trained during these 3 months. And also during this urgent support, we've been able to repair track for routine immunization in Cameroon. And so implementation has started in 2 countries, that is Ethiopia and Kenya. Now this is the 3rd country. Isn't that exciting? So then we have Pillar 3, which strengthens vaccine manufacturing, human vaccines. So in Pillar 3, we've been able to commence monthly meetings with member states on vaccine manufacturing. And these member states are Morocco, Nigeria, Ghana, Ethiopia, Botswana, Uganda, Kenya, South Africa, and Egypt have been engaged in manufacturing. Also, we've been able to consolidate an emerging consensus with the African Union COVID-19 Commission for the authorization of African pooled procurement architecture. And up to more than 50 Africans have been sent for biomanufacturing training at the IVI in South Africa. South Korea, we have JD is one of us, yeah? So, and we've also, we've been able to engage 12 front runners, national regulatory authorities on PVME support and reconstitution technical committees that will support the regulatory oversight. So basically we are strengthening the systems. Then in Pillar 4, what we're doing is strengthening Africa CDC capacity and capabilities, and DHIS2 has been launched, where we are actually now inputting data, and for monitoring and reporting data on health programs. Then we have actually developed standard operating procedures for urgent support and created an outline for mass campaign manuals and manuscripts. So the impact of the program so far, that we've been able to set up the relevant organization and government infrastructure for the program. Then 3.2 million administrators across that had required urgent support for the program. In these numbers at risk of expiring. The capacity to be able to deliver these vaccines. 15 out of the 17 partners contracts have been signed, and 49 out of 5 African Union member states have voluntarily joined the program to date. And 33 microplans have been completed, and implementation has started in 2 countries. So from tomorrow then we'll have implementation now in 3 countries. So this is a brief overview of the activities that happen in Pillar 2, where we do procurement and we deploy the vaccines in the country. And so we have the first work stream is procurement and logistics to the central medical stores, where the vaccines that were procured in Pillar 1 are actually now delivered to the member states, and they delivered to the central store. So this is through either the core vaccines or the ancillary products for the vaccines, the masks, the syringes, the gloves, the PPEs. Then also in Pillar 1, we're supposed to coordinate overall supplier management and strengthen the systems, and to ensure that the required systems and tools for vaccine supply management are in place. This will be taken by UNICEF in Rwanda. So they are going to procure any the required to enhance vaccination. Now, in Pillar 2 is in-country logistics, where these vaccines and ancillary products are delivered around the country. This is by WFP, a World Food Program, and as a partner of last resort, meaning that in countries that are unable to do in-country logistics, then WFP comes in. So then we have risk communication and community engagement, which actually now goes to, we are going targeting to understand the drivers and scales of vaccine hesitancy and develop strategies to combat this. Then we implement RCCE strategies across the selected countries and set up systems and tools for effective communication. This will be done by, it's being, in East Africa, it's being done by the Kenya Red Cross, and the Rwanda Red Cross have been subcontracted to do the risk communication and community engagement. And so they're here. Then we have COVID-19 vaccination centers, where either we set up new CVCs or we strengthen existing CVCs, either by hiring, training, or managing CVCs staff, either procure CVC supply. This will be done by AMREF. We have Jackie representing AMREF here today. Then we have safety surveillance, where we set up systems for reporting for adverse events following immunization in the country. And in countries that are selected this, where they're supposed to be able to build investigation and analysis capabilities at the national, regional, and continental level. And so, currently in Rwanda, this wasn't selected. Then we have genomic sequencing, where we are strengthening the existing laboratory and sample referral network. And we are supposed to be able to manage data and systems and conduct training, ensuring overarching programmatic governance. Then we have technical assistance to countries, where we ensure that there are robust strategies and microplans, and to ensure that we have successful implementation of the program, and we ensure that we have proper performance. Then we have data and information system, where actually we're supposed to strengthen the IT function of the Africa CDC. This will be able to provide real-time data collection and reporting tools for programs, to make us respond to emergencies much more quicker, understanding the real problems. Then also ensures the aggregation and interoperability of key data and IT operations. Then also hiring of program staff. The program has been able to review all recruitment materials developed, advertise for and screen for positions on the partner network platform, support interview and selection processes, and manage contracts to new employees. Then we have implementation science, where we are going to conduct research on real-world vaccine effectiveness on public health impact. Then also identify and codify the barriers and success factors for rapid immunization. So these are the major 10 thematic areas in Pillar 2 that are supported by the Saving Lives and Livelihood program. Now, through the program, 12 member states asked for urgent support, and as you can see that the funding came from two major sources. One was from the MasterCard Foundation, which supported a total of 9 countries, and we have the PACARD, or the pooled funds, which supported the 3 countries for this urgent support. And you can see the only country right now, Morocco, is the only one which actually, for the exception, they requested for vaccine effectiveness study research for rapid vaccine. Otherwise, all these other, the other 11 states that requested for rapid support, actually we were able to help in vaccination of the people. And so the countries are Cameroon, Lesotho, Liberia, Morocco, Sierra Leone, South Sudan, Tanzania, Uganda, and Ethiopia. Then we have Namibia, Kenya, and Zambia. Now, the good example here is is Kenya, which actually launched 2 weeks ago, and after completing their rapid support, their urgent support. So the key lessons that were learned from these 12 member states that required urgent support was that we are supposed to be able to build and manage relationships with member states, with the national health institutes or the public health bodies, through the implementing partners. And this is very crucial, that we are able to have good relationships. Then using trusted voices in the community, that is the religious leaders, the politicians, and the traditional leaders. They help reduce vaccine hesitancy in the community. Then if we are able, we leverage on mass social gatherings, which can drive vaccine demand generation. And then when you're combining COVID-19 vaccination centers with mobile centers and outreaches, that is to the markets, to the universities, to the churches, yield more results. Then using consistent branding, this helps not confuse the population. And then support local initiatives, like in Tanzania, there was Pay for Performance, which actually helped in driving up the vaccination. And then utilizing existing healthcare centers. And so here we can see that of the countries that actually completed the microplans and started implementation, Ethiopia started and kicked off in June on the 9th. Then we have Kenya, which kicked off on the 22nd, launched the program. And then now we have here Rwanda, which is on the 8th of August. And that is a major achievement for this program. And so these are the activities that came towards implementation of the program. And we had a regional, we had a meeting with the implementing partners on work plan orientation. So all the partners have aligned their work plan. And then we've had series of virtual meetings to discuss on these work plans. And then we've also to engage MOH and the implementing partners. And now we are really kicking off, which means that activities now should be able to commence as soon as possible, immediately. So through this partnership, the SLL program will support vaccination in 4 key areas, and through procurement and logistics, which will be done by UNICEF, a total of 653,000 will be 100,000 will be used. This is in USD. And then we have AMREF, which will is supporting CDCs by hiring 200 staff to be sent in 21 CDCs at a tune of 1.174 million USD. Then we have the Kenya Red Cross, which subcontracted the Rwanda Red Cross, which has 254,000 to 86. Then we have IDI, implementing science, which will be able to conduct research at a tune of 105,000. So the total support comes to 2.1 million USD for Rwanda. Now, the coordination of the program in the country will be led by the national coordinator, and they will be able to form a program implementation team where we've had several meetings, which consist of representatives from the member states, the implementing partners, and Africa CDC. So currently I'm the interim national coordinator for Rwanda, and we work with the MOH and the partners. And then the major roles of this team is that the government sets the geographic and support areas for priorities of implementation. Then the implementing partners conduct activities in accordance with the microplans and report the implementation data through the DHIS2. platform. And Africa CDCs monitors and support the implementing performance of the implementing partners, which will be led by Dr. Acham. So this then forms the program implementation. So which we have already started working closely, and especially now that we've started the implementation process, this will be highly critical for us to progress and to have positive results. So Ethiopia began implementation in June 2022, and they had a regional launch in Dire Dawa on the 11th of June. And through the support, the support requested for supportive supervision, technical support, and ratings after the campaigns. And you can see here that from their request, there was a mass vaccination campaign that was carried out, where we had actually 561,000 vaccines administered through the 5 regions in Ethiopia. And then for the SLL contributed to this achievement here through supporting the vaccination drive, because there was a mass vaccination campaign during this period, week 23 to week 25. That is the month of June. And then it supported supervisor allowances during this support and helped in recruit 55 technical staff. So we see that when we work together, then we can actually be able to achieve good results like here. The figures go down a little bit because of the mass vaccination was reduced. There was a mass vaccination in this duration. But this now has they've now started employing mobile vaccination around Ethiopia, and so we expect that now we're going to see higher figures. And so these are some of the pictures in what happened in Ethiopia. And this is the implementation kickoff that happened in June 2022 in Kenya, where we had the ministry and the being represented. We also had Dr. Cham representing the Eastern Regional Coordination for the Africa Union, and Dr. Fala. Yeah. So that's it, and thank you. I think now we'll have a brief presentation from our partners who are present. Yeah. We'll start with RCCE. UNICEF would like to send its convey its condolences because they could not be able to come today. They had an emergency meeting.
Good afternoon, everyone. I repeat, my name is Tumebaze Fred from Rwanda Red Cross. Yeah, my colleague will go through the presentation, but I want to give you a brief overview of the Red Cross. Actually, we're doing RCC because of the capacity we have. We have a big network of volunteers across the country, across the communities. So these are the people we are telling, among others are the volunteers who be vaccinated. So we've been doing this we started this journey with the Minister of Health. We have many projects which came for mobilization of vaccination, and then this project came to continue the work we're doing right now. We do a lot of work. Mostly it's done by our volunteers. We have trained volunteers. We keep on refreshing them. You'll be seeing training of volunteers, training of we have a call center where it does normal, its tail work is the PSS. So included the portion of RCC have hesitancy on the COVID-19 vaccination. So we hope that we're going to do a great job with the AMREF, Ministry of Health, and UNICEF to do this. As we've been doing several meetings with the partners, we hope that all the activities will be going hand in hand. We mobilize, and then at the same time we have the scent of the AMREF or MOH to do vaccination, because you can do mobilization, and then if you don't have somebody to vaccinate, then people will start hesitating after leaving the place of mobilization. So I will hand over to Thierry to do the presentation. Yeah, he's from the communications. Thanks.
Thank you, Fred, for the introduction. Yes, it will allow me to go straight to the presentation. Basically, this is a general overview of the activities we are going to implement. The very first activity would be to reduce the vaccine hesitance through a meeting and a project insertion meeting and communication channels, communication materials that will be broadcasted through different channels like spot for radios, TVs, and DJ mentions. These are the tools that we've been using ever since we worked in risk communication and community engagement. We will also develop and use branded visibility materials. This is for community-based volunteers for the Rwanda Red Cross. We will train these volunteers and staff on risk communication and community engagement on COVID-19 vaccination. We will also support on training of local journalists on COVID-19 vaccine. We will increase COVID-19 vaccine demand by supporting community mobilization activities and by also working with community health workers. We will use other channels like mobile cinemas. I think some of the partners we've been working with know how we use mobile cinema to save lives. It is a tool that we use to mobilize communities. We set up tools in a community, and then we share key messages. We will train emergency operation centers. We have volunteers. We have set up a call center, and we have volunteers in that call center. We will also call them and engage in this journey of vaccine demand. To ensure adequate systems and tools for effective communication, we will train our community-based volunteers on rumor tracking. As Fred said, we already have a network of volunteers. There are more than 50,000 across the country. We will also ensure adequate systems and tools for effective communication for rumor tracking. It is a way of responding to the rumors that we have gathered from the community. And to make it more productive, we will organize coordination and review meetings at the national and the regional level. We will also have joint monitoring and supervision visits. We will identify, document, and disseminate success stories and testimonies from vaccinated people. And as we have already said, this is a this is an implementation that is joint between Rwanda Red Cross and Kenya Red Cross. That is why you see that we will have several meetings between the two national society. One is Kenya Red Cross and the other is Rwanda Red Cross. And this is the calendar. We are supposed to start the activities in the middle of this August. And here is the indicator reference sheet. It is a summary of the program. As you may see, we are planning to reach 60% of the total population of the country through social media, media and the traditional media. We did not want to list all the communication channels, but when we say social media, you understand that you are talking the digital media like Facebook, Twitter, and others. When we say traditional media, it means radio, television, and newspapers. And we will also reach people through the social demographic data, and that is the disaggregation by gender, age, disability, location, etc. And this is 70% is a percentage of the whole number of people we have reached, and 7% it is a number we want to reach. The type of influence will determine the people and the decisions they make. When we talk about decisions, it is about getting vaccinated or not. We also want to reach people through the influence they are making. There is a lot of influence, like in a family, you might know that a mother or a father influence the whole family to get vaccinated. And through our perception surveys, we will have 2 sessions. It means 2 surveys, and we are planning to reach around 3,000 people in 1 session, and in 6 districts. It means a total of 6,000. And this is the approved micro plan budget. I think many of you might have it through emails, and I don't think I would pass a lot of time on it. And that is it. Thank you.
We'd like to thank Rwanda Red Cross for the presentation. And next, we'll have an implementation science presentation.
afternoon once again. I'm called Dr. Eugene Rutaisire. I'm representing Infectious Disease Institute of Makerere University and the Africa Forum for Research and Education in Health. So we are now for these Saving Life and Livelihood initiatives, we are going to work on the implementation science. Looking on the pillar and the overview, for me, I would focus on the implementation science. We have now as we have seen the first presentation, this project is going to work in 15 countries. Then for research, our program will be on the research on the vaccine effectiveness. They will have consortium partner, which is Africa Forum for Health and Education in Health. And of course, we'll work closely with Rwanda Biomedical Center. So we have pillars. For the pillars for implementation science have been discussed in previous presentation, and we are not yet have the local partner, but hope this week we are going to have the local partner. As you have seen on the budget, we have around $1,000 for implementations in the period where, as you have said, we are going to start this August, and by April we'll have all the data and results. So looking on the objective and research questions, the first we want to evaluate the real-world effectiveness of COVID-19 vaccine in Africa population. So there have been different initiatives, but we are working on how this vaccine are working among our population. So when you look on the recent publications, we find out they are most from the Western countries, but we are still working on our own data, how this vaccine, the effective of the vaccine, especially in Africa population. So this will be one of our research questions to find out the effectiveness of the vaccine. This also is coming in where we are having different type of vaccine. Then we want to see within those, in the sub-analysis that we are planning, how all those different type of vaccine are working, what's their effectiveness. The another research question we're looking on to understand the barriers in enhanced COVID-19 vaccine uptake among the healthcare workers. Why healthcare workers matter? We are aware that healthcare workers, they are on the front line of the vaccine. Now, what's the barrier for them they have first to provide such vaccine? So having those barriers will help the researchers to understand what's more they need so that they will help us to mobilize the community to take such vaccine. Our third research questions will be to look on the impact of COVID-19 pandemics on the delivery of national health programs in Africa. So we have seen that different healthcare systems have been affected by COVID-19, but at which extent these COVID-19 pandemics have affected other services. So now our aim here is not to come up with the evidence how the other service delivery have been affected due to COVID. So that will come up also with the real data, which are going to show us in the next pandemics, how can we prepare so that the other health services are not going to be affected. So those are our three main research objectives. How we are going to achieve those objectives and what have been done. We have developed the generic research protocol that have been submitted to Africa CDC for final approval. The protocol customizations and local ethics approval, it will be the next activity. Then other activity will be the data management, infrastructure setup. Then, as I said, we work closely with the RBC through the research division. The data collection and analysis, then finally, the last activity will be for reporting. In details, for the activities, as I said, we have started with the protocol development, which is already the drafting have been submitted to the generic protocol to African CDC. Dissemination and in-country customization for ethics, that will be the next activity. So also, as I said, We have established the agreement between IDI and local institutions to support financial management. As I said, that local institution is going to be determined by this week. The next activity will be ethics and regulatory review. So we are aware that for each research have to be approved by Rwanda National Ethical Committee, where now our protocol is after approval from African CDC, it will now set customized according to the National Ethics Committee. The other activities will be data management infrastructure setup. As we are working with RBC, we have seen that they are using the red cap for data flow and pathway and the confirmation of data collection device. We are also working closely to see how the red cap also will be help us to clear and have the good data. So the next activity will be training and capacity building. We intend to train in-country research team. That's the research team from IDI, then the research team from the local partner, then mainly the research team from RBC. On the protocol, the data management, capacity building for RBC team. On the research implementation, we are in our budget, we intend to recruit 4 staff. The one who will be in charge of the coordination of the activities. We will have the data quality management team with the 2 people, and we also recruit the one who is in charge of the sample at national laboratory. We'll have also to identify the site. As I said before, when you have the micro meeting, we are planning to have the sites here in Kigali, but with discussion of the RBC team, we may find out if we need also to identify the other sites outside of Kigali. Then we start with the data collection. With the data collection, what I can say also, within the micro planning meeting, according to the protocol submitted to Africa CDC, our target population was the adults, but through the discussion from RBC, they also want us to, if we can include also children, and especially those children, and focus also more on the adult population. For reporting the dissemination of findings, we have technical and financial report will be done by the local institutions with support from RBC. Those are the main activities. Now, when you look on the progress, we have signed the agreement with MasterCard Foundations, and some of the part of the funds have already on IDI. Rwanda Micro Plan meeting have already approved for implementation, and as we said, now we are going to start. The generic protocol that IDI have developed on behalf of African CDC, it is now under review. We hope also by this week we'll have the final approval. So as I said, we have tried to identify the local partner to work with RBC, and as I said, also expecting to get feedback by the end of this week. So what's the next step now? The next step is to establish financial flow for local partner and RBC. And as I said, they have done the financial risk assessment done by IDI and MasterCard Foundation, and also having contract with the local partner. Then the approval for generic research protocol for Africa CDC Science Office. So we need also to are going to schedule the implementation science project implementation meetings. We used to have meeting every Tuesday. Now to update, we are having another meeting tomorrow with RBC team on the progress on implementation science side. Thank you very much.
We'd like to thank IDI for that presentation. Our next presentation will be on AMRA CV.
afternoon, everyone. Okay, thank you for this opportunity. I'm really excited to be part of this team. I'm going to talk about two things on my presentation. I'll introduce AMREF because I know some of you have not yet interacted with AMREF, and then I'm going to talk about our scope on the Saving Lives and Livelihoods program. So one, AMREF is a big organization. It's a big health NGO. We have operations in most of sub-Saharan Africa and have offices in about 10 countries in the region. We really hope that we can establish our own office here in Rwanda sometime, but even in places where we don't have an office, we work very closely with have a staff of about 1,500 people in the African region, and most of us are Africans. So we know Africa and African business. We work with ministries of health. We work with other institutions for lasting change in the region. A bit of things in there. One of them is the Africa Health Agenda Conference. I don't know how many of you attended that conference. A really big conference. The last one was held in 2019, and we do this in collaboration with the Ministry of Health. We had over 1,800 delegates coming into the country from 49 countries, all together from that conference. We've also worked very closely with the Ministry of Health in establishing health posts here in Rwanda, specifically in 2 districts, and we've established 14 of them so far. Other than that, we're also working with the Ministry of Health for sustainability of the community insurance program. Last month, in March, we had one big conference that focused on this in the region. So we are not new to Rwanda. We have a lot of work going on. We work with other partners such as the Society for Family Health. We work with BUFMA. We work with Ministry of Health. So are one people. Africa CDC is also one of our main strategic partners in the work we are doing in the African region, especially in the COVID-19 response. So far, we are working with them in 31 countries, and most of our work is around institutional strengthening. So strengthening capacity of Africa CDC, strengthening capacity of other health security institutions in the continent. We've also done quite a bit of work on the vaccination program, strengthening capacity of new and existing CVCs, demand creation, work around data management, pharmacovigilance, and all together we've vaccinated close to 4 million in the last 6 months across the whole region. Moving more closely to this Saving Lives and Livelihoods program. Our scope is going to be on the CDC pillar. Red Cross has mentioned that their scope is going to be on RCCE. Ours is going to be on the COVID vaccination centers. And in that place, we are going to be establishing new centers in some countries. We are going to be supporting the existing ones. We are going to be training healthcare workers, ensuring that the data is running well, ensuring that we have the right supplies in these COVID-19 centers to ensure that we can vaccinate as many people as possible. Our scope on this program, we have some countries in the Southern Hub, and we have some in Eastern Hub. And that is what brings us here to Rwanda, because Rwanda is one of our most important countries that we are going to be working in under the SLL program. So this is a summary of what we are going to be doing. When we came for the micro-planning exercise, we worked very closely with Africa CDC and the Ministry of Health in trying to determine what AMREF is going to do for the next 12 months to ensure that we can accelerate the vaccination program. And we were in agreement that for the next 12 months, what we want to do is hire and deploy 200 healthcare workers. And these healthcare workers are going to be mainly data clerks and vaccinators. They're going to be posted to about 21 CVCs, but we also appreciate that a lot has changed since we had the micro-planning exercise. So we are going to be working very closely with the government, with the Ministry of Health, to decide where we want to deploy these 200 healthcare workers, what target populations they're going to be reaching in the next 12 months. At the end of the day, we want to see not less than 700,000 people vaccinated, and that means we have to work very closely with each one of us here in the room, with UNICEF, with Red Cross, with the Ministry of Health, because at a bare minimum, 720,000 people need to be vaccinated. And the government has just lowered the age. We are now talking about children above 5 years of age. So we have a huge task ahead of us to just ensure that we can meet and surpass our targets for this program in Rwanda. We have commitment of about 12 months, even if the program is a 36 months program. And therefore, what we are working with right now is for the 12 months. So for the next 12 months, we are going to employ 200 healthcare workers. We are going to pay them accordingly as per the government terms to ensure that they can work with us in meeting those deliverables. Our budget is $1.1 million, and we are going to be working very closely with BUFMAR in meeting these objectives. And once we meet those objectives, we hope that we are going to take advantage of the upcoming conference next year. Again, it's going to be in Rwanda because this is a very strategic place in the region. And we hope that in that conference, we can showcase what we are going to be able to achieve together out of this SLL program. Thank you very much.
We'd like to thank Emre for that presentation. Now, we open the floor for any questions or discussions that anyone might have. Any questions? So we all are in agreements that we are launching and everything is clear? Okay.
Thank you very much for the presenters. It was really clear. Mine is just to complement on the proposed next steps. As you rightly said, just in a different context as the one we're in now, right? So I would propose like tomorrow, since the project is launched, in order to hit the ground and start the implementation, I would propose tomorrow in the morning we have a small working session and see where we need some small tweaks or adjustments so that different groups can start the implementation without losing a lot of time without implementation. That was my proposal as next step from here. Thank you.
I'd like to thank you for that. We are going to take that and we're going to actually meet in the morning tomorrow. So we're going to set up a link and plan for that. Yes, sure, we can. But there's some partners are flying out today. Yes. Okay. Yes. Yes. Okay. Yeah. That's 11. Okay. Yes. We'll meet tomorrow 11 a.m. at RBC headquarters. More questions?
Thank you. So probably before Jacqueline leave, so Jacqueline, because actually we have an ongoing vaccination campaign, and we already have those 200 people supporting vaccination activities everywhere. So probably we need from you what is required so that we can start implementing it, because we think we don't need to hire additional people. So we are going to see contracts of those people. So would like to make sure that we can start supporting these activities by already paying those people supporting vaccination activities by this August. So before you leave, let us know what is required so that we can make sure that we are aligning with your policy. But also, we would try to introduce us to people Gufma. I was expecting to have them meet.
Any more suggestions, questions, areas of clarification? Okay, then without much further ado, then Dr. Acham can allow us to leave for lunch.
And so success begins from here. So we really sincerely thank you very much, because this is something COVID has taught us. You know, when everything has its own advantage, one thing what we learned during COVID pandemic is working together and partnership. You know, together we can really make a difference. And there is nothing more interesting than doing something, but also looking at the outcome. So we are almost going there, and we were saying maybe after a year and a half or two, we no more be talking about COVID pandemic, and that's why we also need to think ahead about integrating the efforts we are doing now to make some difference in the other essential health services, the immunization program. So as we work, we all need to keep this in mind in leveraging the capacity also in other immunization programs. So, on behalf of Africa CDC and the SLL program, I really sincerely want to thank you very much. And so the work has begun. And tomorrow we have another coordination meeting. And even today, after this, there is another coordination meeting. So we'll keep this momentum. And we need to read one another to synchronize our efforts and make an impact, because all what we are doing need to go together. You know, we need to have the logistics while we are doing the RCCE. We also need the evidence that would boost our efforts, and we need the more vaccination centers to bring the vaccine into people's arms. So this needs to go together. So without talking much, I want to thank you very much again. And come out, tell us where is lunch? Okay. Okay. Thank you very much. Thank you. God bless you.